Is the microphone on? Not there it is. Okay. Good evening. Welcome to the Lafayette Library. My name is Vicki Shaka. I'm manager of the library, and I welcome you on this very special evening with our very special guests. Before we get started, I'd like to remind you to please turn off all electronic devices. And I would like to give a big thanks to Janet Levin and Julia Kent from North Atlantic Books, who helped us put this wonderful discussion together this evening with our special guests, Sister Abegail and Meg Stiles from the Greta Foundation. I want to tell you about one or two events coming up. We have so many, but I did want to mention author Vanessa Diffenbaugh, who will be here in April, on April 6th. You may remember her book, The Language of Flowers. She has a new book called We Never Asked for Wings. So she will be here in the community hall again on April 6th. We have lots of other events coming up, author events, all kinds of technology, presentations. We have somebody from Lucasfilms coming in March. So if you don't subscribe to our website and email blasts, you should definitely get onto that list because there's a lot of wonderful programs. We wouldn't want you to miss them. We have an ongoing music series here that has been growing in attendance. We had almost 200 people at our last one on a Friday night. They're free music programs, anything from classical piano to jazz, all kinds of wonderful programs. So look for those too. Our next one is March 19th, and it's a Master Artists Evening Concert with classical piano with the Contra Costa Performing Arts Society. So I don't want to waste another minute, and I would like to bring up Janet Levin from North Atlantic Books, who will introduce our very, very special guests this evening. Let's give a warm welcome to Janet Levin.
Good evening, ladies and gentlemen. I'm Janet Levin with North Atlantic Books, and we are delighted to be here tonight. We want to thank the Lafayette Public Library for allowing us the opportunity to present you with two incredible women in conversation about the very important work they're both doing. Reverend Archbishop Desmond Tutu once said, "Hope can rise from the most adverse circumstances." The life and work of Sister Abegail Ntleko show that. Hers is a remarkable tale of what it means to be truly human. To be truly human. Well, tonight we have the pleasure, indeed the honor, to present you with two speakers who in their own ways exemplify what it means to be truly human. Abegail Ntleko grew up in a poor rural village in South Africa, and against seemingly insurmountable odds, including having a father who did not believe in educating girls, got her nursing degree, and dedicated her life to those in need. Overcoming poverty, racism, governmental bureaucracy, and the apartheid system, she has for more than 40 years legally adopted scores of children and raised even more, many of whom lost their parents to the AIDS pandemic when it first hit in the early 1980s. She is the recipient of the Unsung Heroes of Compassion Award presented to her in 2009 by His Holiness, the Dalai Lama. Abegail is here with us tonight and throughout her Bay Area book tour to share her incredible story as a community activist, nurse practitioner, tireless healthcare provider who successfully brought clinics where none existed in rural areas, a champion for breaking down racial barriers, and a mother to hundreds of orphaned children. Overcoming poverty, racism, and sexism to earn her education and live a life in service to her community, for over 40 years, she has helped the needy. She presently, at age 82, is raising 20 children at the Kulungale Care Center in South Africa, and many of those children were on the clip that was just showing. I had the privilege of meeting Sister Abegail and her children in South Africa over a year ago, and I quickly realized I was in the presence of someone very special, which I think you will also observe this evening. Her energy, compassion, and love remind us of the simple fact that we are ultimately here to help each other, and that change does begin with the individual. Meg Stiles, president and founder of the Greta Foundation here in the San Francisco Bay Area, also knows what it means to be truly human and to live a life of service. She founded the Greta Foundation in 2007 to honor her mother, the late Dr. Margreta Madden Stiles, or Greta as she was known to her fellow nurses. As past president of the American Nurses Association and the International Council of Nurses, and winner of the nursing profession's highest honors, Greta was a nursing scholar renowned globally as an international leader in nursing education, regulation, and credentialing. Greta was the architect of the first comprehensive study of nursing credentialing and an innovator and pioneer in defining this critical work that recognizes and differentiates quality in all aspects of nursing practice. She spearheaded the International Council of Nurses' definitive work on nursing regulation, and it is through Greta's work in credentialing and its contribution to better patient outcomes globally that Greta leaves her most enduring legacy. The Greta Foundation's mission is to provide in-country nursing education to impoverished persons living in disease-burdened nations while improving patient care and outcomes. The Foundation offers nursing and midwifery scholarships to persons most vulnerable and disadvantaged, many being AIDS orphans and conflict survivors. This education empowers these special scholars by providing the tools to enter into this indispensable profession. A nurse's contribution to humanity through a career of care and cure is incalculable, and by increasing the nursing workforce where it is desperately needed, there is greater hope to stem the relentless advance of diseases like HIV and improve patient care worldwide. Since its creation, the Greta Foundation has provided nursing scholarships to over 40 women and men in Malawi and Uganda. Those scholars, in turn, have brought better health care back to their local communities and touched and saved countless lives. The two women who will speak tonight have dedicated their lives to being fully human and to living a life of service. So if ever your faith in humanity is waning, you need simply to look at people like Abegail or Meg or Greta or the countless individuals who work in compassionate service to realize that they are the embodiment of Margaret Mead's statement, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." Please join me in a very special welcome for Abegail, Ntleko, and Meg Stiles.
Good evening, ladies and gentlemen. I think she has said a lot. I wasn't here about me, that I'm an old lady from KZN in South Africa, in Untitled, the country that is full of good scenery. I'm wondering if I'm going to play the, no, not going to play the clip for the children. You already is. In fact, my children said, I must make sure that I hug everybody in the USA, which is very difficult. My hands can. But I'm just going to hug you on the air. And the second thing is that whenever I go back, I've been here 3 times. Whenever I go back, they always ask me, the first time they asked me if have you seen Michael Jackson? I said, my darlings, he died a long time ago, so don't ask me that question. There are so many stars that they love so much about America. That's one of the reasons why I always in my prayers say, God bless Africa and America. God her children and guide her leaders and give her peace. So both countries are just in my heart. Just to cut the long story short, I was born in Harding, in a deep rural area where there was only one church which was run by a missionary, lady missionary, Miss McCartan. And she conducted Sunday school first before the church service. And it was an area which was full of heathens. People were not educated. Even the teachers that came to our area were recruited from the Eastern Cape, which is far, far, far from us. And they were staying in houses. And I was dying to be educated. And I lost my mother when I was 4 years old, who died in 1938. I kept on saying to my dad, can I please go to school? I said, in this house, no girls or females go to school. You're not going to be educated. I ended up at the age of 10 asking him, why are the females not allowed to go to school? You're going to sell your bodies in the harbors. I don't know where he got this from, because he never worked in Durban, which is our nearest harbor. But at the age of 14, I felt that no, I cannot go on anymore, because I could feel and I saw a couple of children who were educated, being able to read the Bible, being able to read the letters. Then I thought to myself, I'm growing, and I'm going to be an 18-year-old, fell in love with a guy who works in Joburg, and then if he writes me a letter, I have to take this letter to somebody who can read it first and start smiling and say, listen now, that's what he says. You can just imagine. I'm one person that wanted to be empowered. I looked after my father's cattle from the age of 6. He used to drink like a fish and smoke like a chimney. He even abused the cannabis sativa, smoked it. And when I asked him one day, why are you always dead? Why are you always drunk? He said to me, no, my child, I'm trying to comfort myself because I lost my wife, I lost a lot of children. Because we were 13, by the time my mother died, he left us being 6. Now we're only 2. And that was the way that he made himself happy, is to be always drunk. So for him to be drunk, I didn't mind. He was such a loving father. He had so many things that he taught me. I was nice and strong. He used to say when we spanning the oxen to go and till the ground, when I say, I'm short, I can't hold this, he would say, don't you have 2 hands? I say, yes, Dad, I've got 2 hands. It's only 2 hands that work. It's not that you need to be a boy to be able to span the oxen. That was the type of a man who made me strong. And that's why I've named the book Empty Hands. Because one day he said to me, he was just coming from his outings. I don't know where he went to, because he came back being sober, and he sat outside, didn't get into the rendezvous that you see in the book. He said to me, just give me the soil. Make your hands full of soil. And I was looking around him, and I said, why does he want soil? Because there's no cat that is messed next to him. And the dog is such a clean dog. My dog, which is named Chomi. And so I scooped this soil, brought it to him. He looked at me, didn't even worry while I was standing there with the soil. And I thought, perhaps he wants me to kneel in front of him. I did that. And then he just felt in his bag and took 2 bananas. He peeled one, started eating it. Would you like this banana? I said to him, yes, Dad. Where must I put it? On top of the soil. I said, must I throw it away? He said, it's up to you. Empty your hands. You know, that worried me. I ate this banana, tried to clean up my hands, took the banana and ate, and I said to him, I don't even understand what this means. He said, you know what? You must learn to let go things that are not useful in your life, like hatred, don't grudge anybody, and never feel that if life is difficult, it will never be right one day, so must learn to let go. That really helped me. There's nothing that is a problem to me. I don't have problems. I've got challenges. I take them as stairs that are going up. And if you're going upstairs, I saw these stairs here when I was coming up at the age of 82. I was going up, and one person that was with me said, "Are you not worried, Gogo?" Okay, I said, "No, don't worry. It's going to make my heart good." But by the time I arrived, she didn't notice I was behind. I started panting. But I was up here. I was able to go up. And at the age of 14, I rebelled against my father with a smile. I said, "Dad, today I'm going to the school to find a space for me." And said, "You are not going?" I said, "Dad, I'm going," with a smile. And he said, "Well, do as you please if this house is yours." So I did as I pleased because the house is mine, it's mine. So I went to the school in traditional attire. When I arrived, all the schools in South Africa mostly were built by the missions. The teacher said, no ways that will admit you to school. You must go and find a dress. I had no dress. I had beadwork in front and a piece of cloth at the back, which is the traditional attire, all the boobs out. So I went to the mission. I said, "Ma," I used to call that white lady Mom. I said, "Ma, I need a dress." "Oh, but you know that we have to work for the whole year." I said, "No, it's January. I'll definitely come to school every day." "And what about your father's cattle?" I said, "Well, I found people who are going to look after it, and I'll only work over the weekend looking after the cattle. So don't worry, give me a dress." So he gave me the most beautiful dress, light blue with a small, big belts at the back, with tied like a bow. I looked so cute. But now it's one dress. So I used to wear it from Monday to Friday, and if it's not dirty, I hang it up so that, it gets some fresh air. And being 14 in grade 1 with 5 to 6 year olds, I used to control them. They were not allowed to come near me with those dirty hands and touch my dress. When was I going to wash the dress? Because on Saturday I took all the other boys' curriculum and looked after them. So I was very strict with my dress not to be touched. This continued, and I moved on the first day with that dress looking so pretty. I moved up and down the whole school. The teacher was laughing at it because he asked one after another, "What do you want to be when you finish school?" Some said they want to be tractor drivers because their uncles were driving in the farms. And when she came to me, I said, "I wanted to be a nurse." "Have you ever seen a nurse in this area?" "Not when you people don't even have teachers." Wrote a piece of note and said, "Go to that class and give it to the teacher." Gave it to the teacher. Teacher read and killed himself with laughter. He said, "Girls, you are now in grade," it was not grades then, it was standard. "You are now in standard 6. What do you want to be when you finish?" "Oh, you always say so." "Let me ask this girl, how old are you?" I said, "I'm 14 years old. What do you want to be when you finish school?" I said, "I want to be a nurse." "Oh, nurse? When are you going to finish?" I said, "Well, but I want to be a nurse." Fortunately, God is so good to us. When I eventually, in fact, I completed junior certificate, which is grade 10, when I was 29. I started in nursing when I was 30. I completed when I was 35, general and midwifery. And I did a couple of courses. But before I did those diplomas in nursing, psych, peds, and mothercraft, ophthalmic, I went to apply to one of the hospitals which are much nearer home. My father was still alive. He had stopped drinking because I now was giving him everything and being a nurse, buying him good things, and he stopped. So when I went to this hospital, the matron said, "Sister, just go to the laundry with your ID and collect your uniform." I went down. I was nice and tiny, It's lovely to be short, but be careful. Those who've got boys, tell them not to get married to short women. They are very pushy. They put a thumb on a jugular. You have to do as they please. because they are short, we compensate with some pressure of some sort. So I went to the laundry.
You're taking all my best questions.
Yeah.
I've got to cross off all these questions.
No, I'll answer them again. And so when I went to the laundry, I gave looked at me and said, who's this? I said, that is S.A. Ntleko, Siniti Abegail Ntleko, the one that was in your class in grade 1. Don't tell me that. Bring that ID. Looked at how? What did you do? I said, well, I told you I wanted to be a nurse. Now I'm a sister, a professional nurse, not even an enrolled nurse. I'm just a professional. She looked at me and said, no, I can't believe this. I said, well, give me uniform because I need to be shown to be orientated by a certain sister in one of the wards. She kept each child in that area that was running away from school. She would say, bring that child to Redfay Hospital. There is a sister that I taught. She was so old, she must go back to school. So none of my children can say to me, Gogo, I think I'm too old, I can't continue. Because even last year in January, I was 18. It was not January, it was in March. I did elder care course, and I got 85%. To show that the brain doesn't get old. It's always new. Use it as much as you want to. So to go through university, I had to be matriculated. So at the age of 56, I enrolled 7 subjects in matric in 1 year, and I had babies already. I started adopting and fostering. So I had an 18-month-old baby and a 9-month-old baby. Those were abandoned. It was an emergency that I took them. So I took 7 subjects, and I failed 1 with the Arabic polls. You can just imagine age, failed dismally. But 6 I passed because of the age. I'm 56, I got the metric certificate, which is higher education. Then I applied through KZN University. I enrolled in community nursing science because my heart is in the community. I want to see my patients where they are, where they live, and correct them where they are, helping them to improve their life in their own homes. So I did that, and then I graduated when I was 59 years old. But I only retired when I was 64, going for 65. And I started a huge, when AIDS pandemic arrived in KZN, there were a lot of child-headed homes where a 13-year-old will be looking after the siblings. Before the parents die, the home becomes child-headed. So they were looking after the parent, making sure that the siblings are okay, they go to school, then she goes to school. When she comes back, change the parent who's bedridden, having diarrhea, wash the linen, hang it outside. It was hell. Then I started taking those children in the childhood homes to give them a home, to get love and be fed and go to school. And then I mobilized in each area the caregivers. I trained the caregivers, then I supervised them. I used to buy very cheap cell phones, even for the children. Say, if you see that my patient is changing, the condition is changing, it was before ARVs, let me know, then I'll rush in there. So I used to run in the middle of the night to do the last offices for my patients when they died.
Can I ask you a question?
Any question?
First, I want to say it's an honor to be here to meet you and to have the opportunity to learn from you. I grew up with nurses, and I learned from my mother, Greta, that nurses were the most extraordinary people, and it was the most honorable profession. And you answered all of the good questions I had about your childhood, so thank you. You made my job much easier. But in your nursing profession, you kept getting additional training such as psychiatry, et cetera, different specializations. And I have to ask you, has anyone asked you why you didn't become a doctor? And if so, what was your answer, or what is it now?
Doing medicine, I didn't have money. So with medical school, we needed to have money to pay the medical school. With nursing, it was not like today. We didn't pay in nursing. We used to apply in the hospital and be taken, get paid, get into the lectures. Between the lectures, there were times when we did practicals in the wards. So the reason why I didn't become a doctor, I had no money, that's number one. Secondly, getting matric at the age of 56, then just imagine, plus 7 years, medical school. I wouldn't have practiced.
Well, I would argue too, with nurses providing 85% of patient care, that you have such a desire to impact so many people in the community that nursing was the best profession to do that.
It was
more so than a doctor.
More so than a doctor, because the doctor is tied up to his room or in hospital. As a nurse, I'm that type of a nurse that doesn't like admin work, likes to be hands-on to the patient.
Our Greta scholars see on average of 70 patients a day. And here, people in the U.S. find that really hard to understand. You, however, see hundreds of patients a day, especially when you are the only nurse working in very rural communities. Can you please help us paint a picture of what that would look like, seeing hundreds of people waiting to see you?
The queues, by the time I arrived at 7:30, I used to go there early, knowing that I'm the only nurse and people here had no other health service except going to the doctor. We had 2 doctors in the area, though they pay them, but sometimes they used to waive the payment, seeing that these people were poor. But one doctor was retired. So if the other one has been doing deliveries right through the night, because there was no residential clinic, doing deliveries the whole night, they had a tendency of giving themselves time to go to the hotel and relax, which was good, because you can't go on and on and on and on. So with me, I used to go out have stations. I mapped up the area, looking after these farms in this area. Then the farmers used to bring people into the farm where I've got my clinic point. And where there's a lot of thickly populated area, I used to work at the shops or in church or at the school. Then people would flock in there. Because the area didn't have services, I had no guts to say to them, now I've seen 200 patients, the rest go home. There were times when I worked with the lights of the mobile service, used to put the lights on so that I can see what I'm doing, and working under the tree. And when it's getting colder, because the place is cold, I used to ask for a room where I can work in or pitch up a tent. But now lights, I had to use the vehicle lights, keep it idling so that the battery is not flat until I finish them. Then my boss didn't believe that my supervisor from Marisburg, she was staying 152 kilometers from me. She said, I can't believe that, Abby, I can't believe that. I said, Mrs. Stridham, the best thing, I would like you and the MOH of health to come and see me working. So I gave them 3 difficult clinics. When they came, I said, well, all right, we'll leave early. And the first thing that I did, I loaded them with coffee and some scones, because I knew there were no toilets where I was working. When they started saying, where can the bathroom? I said, there's no bathroom here, it's just behind the tree. I said, you do the same, Abby? I said, yes, I do the same. Go behind the tree or behind the van, or I open the doors. so that I make a place to just a week. And from there, I said, no, I think the best thing, because you can see the queues are just, they looked as if they were walking on a snake, it would be killed. And I said to them, we'll have 3 queues. One for the doctor to see all the sexually transmitted diseases, menstruation, then you see minor ailments. I'm going to deal with the antenatals and immunization. By 4 o'clock, they said, we need to go back to Marisburg. I said, you can't leave me with these people. We need to finish them. They must go home. I said, no, they can't go home. They are sick. They came here for a purpose. That's how I worked these large numbers. And they eventually gave me 2 more nurses. So we had 3 queues with these nurses. But also it was not enough. By the time we arrived back at the office, a so-called office, which was a 2-roomed house, we had queues that were waiting for us in the village. So we worked again, and there was no time for us to even to cook for ourselves. The young nurses started complaining, say, hey, sister, I can't stay in such a place. We don't eat in the morning, we leave early, and then when we come back, we don't eat. I said, well, my darlings, speak to Mrs. Stridham. They phoned her, and they said, can you please send us back to Greta? And one said, can I please go back to towns? I can't stay here. This area, there are so many people. And they ended up building a clinic. I said to Mrs. Stridham, best thing is to have a residential clinic. While we're gone out, there must be nurses who are running this residential clinic, where even working people here can go to that clinic, so that when we come back, at least we have time to turn the pot somehow and eat. That's how, because they had promised me when they moved me from Greytown to Underberg, oh, there are very few people, about 300 a month. And the first month I saw 800. The second month it was 3,000. Then I said, that doesn't work. So now I was not giving a quality service, which is not my nature. So I used to say, hello, ma'am, what's your name? What's wrong with you? Okay, just climb on the couch. BP, oh, it's okay. Medicine, bye, next one. That's not good. You need to speak to the people, relax them, and they understand you and you understand them. So that's how I work.
We've seen some of our nurses in the large referral hospitals, not even just in rural areas, but the nursing shortages are so extreme that you'll see in the emergency room, you'll see where nurses doing kind of a triage where they're assessing patients, and they've got no privacy but just a little curtain, and they distribute cards. So yellow if you're lucky, orange not as lucky, and then red if your situation's dire, and sometimes people get black cards because they will have died while they were waiting. And many of these people would come miles and miles to be referred to these, and these are huge hospitals, and it's still, whether in remote or urban areas, it's a really tragic picture, which makes you even more extraordinary in my mind, I have to tell you. I want to pick your brain on something. One of the biggest challenges in nursing and midwifery shortages is recruiting, deploying, and retaining nurses in rural areas. And I know you've got some really good experience with that. It wasn't just you, but you actually got others to come. And can you tell us a little bit about how you do that?
I had requested that our government, if they can give rural allowance, it would be wonderful. Because in the beginning, when we started, all mobile staff used to get the rural allowance over and above. They called it SNT, which is, SNT was sustenance and transport for people who are traveling all around. And then at the end of the month, we used to get that. But immediately when we changed government, that's why in my feeling is that even during the apartheid era, there were good things that were happening. So immediately when the they stepped down and our new government came. They kept on saying, oh, we've got no money. And nurses are really running away from the rural areas. They don't like that life because they don't get money in it. They're paid like any nurse who's in a sophisticated hospital just because they've been in the field of nursing for 5 years. Any nurse that has had an experience of 5 years, either in a big hospital or in the rural, there's no difference. So they are thinning themselves out because in the rural areas, after hours, even on weekends, if you are there, they come. People want to be helped. And sometimes they come for advices. When they see a nurse, they are seeing so many, they're seeing a nurse, they're seeing one nurse is a nurse, the priest, the social worker, the counselor. So they come for all sorts of things. They come and report there has been a violence and such. There's a child that has been abused. You need to jump up. If you don't do that, then you are not a nurse. You can't leave the children to suffer because you say, it's not my job, it's not my job. Social workers, where are the social workers?
Thank you very much. I want to make a little jump because one thing that I thought, there's so much about her story that's so extraordinary. In fact, her book is probably one of the most shining examples of determination, selflessness, and compassion that I've ever read. So there's a lot to ask, but I'll leave some for the crowd, but I have a few more. I'm very curious. What do you think, providing nursing care or qualities that make you a good nurse, how do you think they helped you break down racial walls and divisions? For example, the white farmers in Underberg.
There's nothing, as I said in the beginning, there's nothing to me that is a problem. I've got no problems, I've got challenges. And also, I've got a way of dealing with the problems. I try and correct it, work on it, try and solve it as much as I can. But if I can't solve it, I let go, I just hand it over to the man above. And he does do something. I always remind him that he promised that he's going to do something, he must do something. There were times when I was beaten by the dogs. In fact, it was and also learning to forgive and forget. I went to one of it's just an example to show how you can go around. I went to one of the farmer's wife in her farmhouse, and I had made an appointment that, ma'am, I'm going to be there at 10 o'clock. Can I please see you because you've got a sawmill and I want to see your people and I don't want them to be booked off so that they can go and get injection or if they've got a cold. So I drove I'm one person, there's one mistake that I have. I keep time like anything. If I'm supposed to be at your house at 10, I'm there at 10 to 10. So I arrived at 10 to 10, parked outside, and I waited. I don't like hooters too. Somebody, I don't like. And I stood there. It was so quiet. And I asked myself, they said there are a lot of dogs here, but why is it so quiet? I think this lady must have run away from me. So I stood there, 10 o'clock, 10:15, 10:30. At 11, I said, let me just get out of the car. Perhaps she's just looking at me through the window. This nurse thinks that she's clever. She wants me to come outside. Then I alighted from the vehicle, but I left the door open. One of the nurses was sitting on the other side of the mobile van. So I got out, I walked towards the house. Then I saw there was an old man who was on the nebulizer, holding it like this. Then I said, because they know Zulu, I said, oh, ma'am, which means, where is Madam? Said, he couldn't talk. Then I tried to go back to the vehicle. There Madam came with dogs at the back and the barking. By the time she stopped, the dogs were out, and I hadn't reached the car. I didn't want to run. I know as a person that loves the dog that if you run, give them more chance to bite you. So I stood still, and they came, they ripped my skirt, the uniform. I could see the skirt going there, so I had my hands like this. I didn't want them to hang in case they bite them, because I still had to drive. And I was left with the petticoat and the shirt and the epaulets. You can just imagine how I looked. And there were times when I laughed at that. And she came out and, why did you get out? Why did you get out? And I said, ma'am, I'm sorry. I was trying to get you because our appointment. No, you are the one that is wrong. Look, now the dog's nearly finished you. Then, can you come to the house so that I can get you something to wear? I said, no, don't worry. I'll come in another day. I'm just going to get into the car. At least the top is okay. So I reversed out. I left here. When I arrived at my place, I looked at my legs. They were blue. But there was no chance of the dogs biting me, having an open wound. But just imagine, if you can see my legs, they are as thin as a rake, just like a toothpicks. But they were swollen, blue. And I rang my boss. I said, can you please send me a relief? Because it's just in the beginning of the week, and I've been bruised by the dogs. My boss was such a person that was highly strung. Abby, I'm coming now. I'm coming. I said, please just bring somebody who's going to relieve me. I can't drive. I think tomorrow I'll be worse. So she came and she said, I'm going to sue this man. I said, you can't sue somebody when the mistake is mine. And it's me who's hurt. I don't want her to be reprimanded. The other farmers' wives wanted to do something. She's a very cheeky. I said, it's me that went out of the car. I should have sat in the car, even if she came at 2 o'clock in the afternoon. I should have sat there, otherwise drive away. So I'm the one that alighted. And she was fuming. Hey, the way you handle things, I'm not happy about you. You're so I said, Mrs. Strigan, I don't want any case, no police, I don't want. She ended up being my best friend. She's my best friend. We are friends. After that, she even came and said, how are you? Did you have any open wound? I said, no, I showed you, ma'am, that I don't have an open wound. It's just a bruise. They're going to take time to heal. So Mrs. Durham came, brought the relief, and I healed. I didn't hate him. Let go. Let go. That's very important. And never give up in life. I never gave up and said, I'll never be able to go through these farmers' wives and white shop owners. Now, my orphanages are being supported by the white farmers. I don't buy milk, by a supermarket Spar, which belongs to people who grew up there when I was there, and they are very nice. They love me. I'm just a go-go to everybody, white or black. If you say, I'm looking for go-go, they say, oh, you mean Sister Abby? They'll take you there, even if he's white or yellow or whatever, black. And I don't have any problems.
You've made yourself invaluable to the community.
Yeah.
And go-go is grandmother in Zulu. I want to ask you about your children.
Okay.
You did talk about them some, but I'm curious. I think it's important for people to get an understanding about what life can be like for a child who is orphaned by AIDS, where you have issues of stigma related to the disease and whatnot. And I know that seeing these children and what they were enduring really compelled you to adopt scores and scores of needy children.
Yeah, in the beginning of this pandemic, both parents would die, and the baby would die, and then we got ARVs, and also the method of prevention of mother-to-child transmission, and that helped a lot to save the babies. My problem is not that I wanted the babies to die, because I'm available to look after them. My problem was our government hadn't made any provision for homes, care centers, not the orphanages, because in the orphanage, when you turn 18, whether you've got matric or no matric, whether you're in the university or you're not in the university, they always say to you, "Thank you so much. It was lovely to have you, David," as a baby, coming there as a baby or being 2 years. At 18, bye. Where does this child go to? So my belief is that they must leave me when I've got legs to stand on and wings to fly. Even if they can fly away, don't come back home, as long as I know where David is now working, you can rent an apartment until you can collect enough funds to buy himself a house or pay lobola and have a wife. So that's what I do. Even the sales of the book will go to tertiary education for my children. Let me tell you, the love, the care, advices that you give to these orphans, they get so attached. I've got a 54-year-old still phone me and say, "Ma, I love you, I miss you." And I say, "Me too, my love." Say, "He's a big man now, why is he still attached to me?" He is. He has got wings to fly, he's got legs to stand on.
But still your baby.
Still, huh?
He's still your baby.
That's it. Now, that's my philosophy. And also, I take my children to the English school. We argue the fact with the social workers. They say, "But Gogo, we don't give you enough money to take these children to the English school." At the English school, grade 1 is 1.5 per month. And the government is giving us 860. So I need to top up that with my pension. Fortunately, I'm not an old age pensioner. I'm a government pensioner, which is much better than OAP. And therefore, English is a universal language. If you take them to the Zulu school, maths is not done in school in Zulu. Science is not done in Zulu. Everything is done in English. That's why I want them to, as from a very young age, Janet was there, even the baby will speak English. It's English. And I think it's because I started school very late, so I love this wonderful language, which can take me all over the world. With Zulu, you are contained in South Africa, KZN. With Xhosa, Eastern Cape. With Sotho, you can't say you go to Lesotho, but if you are a South African, then you are contained in the Transvaal or Bloemfontein, OFS or Gauteng. So that's why I take them to the English school, so that they're easily employable. They can easily answer when they're put through being examined for work, what you say that, and they can easily answer so easily with their CVs being there. I want them to get the best because they've been through the worst. So if they get the best, I won't have to babysit them until they are forever. I know that they'll have wings to fly.
I think we know that they have the best with you.
Yeah.
So I have one last question before we open the room to the crowd. How do you think your life would have been different had you been born a boy? How do you think your life would have been different had you been born a boy?
I think I would have been a doctor. or starting early, I would have worked even much earlier, because during our time, people used to take the 5-year-old, there were no preschools or kindergarten. They used to take the children, 5-year-olds, and say they are visiting at the school. Some of them, being clever, they would pass grade 1 early, and then they would finish early. And in fact, I wanted to be a teacher. Most unfortunately, there was no money for me to go to the teachers' college, and that's why, but in my heart, I love nursing, but also I thought perhaps teaching is much higher than nursing. Now I can see nursing is better than teaching. Sorry if there are teachers.
Well, there certainly was
Yeah.
a desperate need where you were, so thank goodness that.
And then my children always say, when I say nurses are better than teachers, I say, how could you be a nurse without having a teacher in front of you?
Thank you. So, opening up for people who have questions. Have any of your children gone into nursing?
5 nurses, 6 teachers, 1 pharmacist amongst the 22 that I brought up first. And then I've got 1 that has done BCom. She is controlling the department where they receive medication, all the stock in the hospital. She's in charge of that. And the rest took up secretarial work, and some got matric and they got married. So there are those who idolized me. So the one that is now doing nursing will be the 6th one.
Very good. You must be very proud. Anyone else?
How many children have you raised?
I divide them according to categories. I've got the ones that stayed with me. I've got the ones that I supervise, the grannies. And also, it's not the grannies, the great grannies who are looking after these children, because if her granddaughter dies, the children come to Gogo. Meanwhile, she has already lost her daughter, who is the granny to these children. And there is a family where the granny was looking after 19 children. She lost 2 daughters, 2 sons, and a granddaughter. So they're all pushed to granny. They must go to granny. You know, after the funeral, there's one question that I usually do, because I conduct these funerals, and also I'm a undertaker. I've got a van where I go to a hospital and pick up the body. And then I ask after the funeral, who's going to take the children, or even before. And sometimes even before this person dies, I will say, where do you want your children to go to? Most unfortunately, well, I want my children to come to you, Gogo. I can't embrace the whole world. I'm not even the president. I'm not even related to him. Did I answer?
You came close. She's got 20 now. 20 now.
I've got 20 now.
Yeah.
I've got 22 that I brought up first. And directly, I've got 5 that I brought up when I was staying in a 2-roomed house. And then I've got 85, which were not directly under me. I had employed caregivers in the first orphanage. The second orphanage, I'm left with the 20 that I'm bringing up at the moment. So I left that orphanage with 85 children, 12 caregivers. It's a cluster foster home. The reason why it's a cluster foster home, we are right in the deep rural area. I wanted to be a children's care center, which is almost like a children's home. And the answer from the government at Natalia, and where all the big shots stay, they said they can't because it's in the deep rural area, and also they're trying to dismantle all these homes. People must look after their own children. Who are those people? The grannies. Because there's nobody. People are dying. Like, I've got one child, you met him, the one that is artistic. He lost 11 members of the family. They've been moved and moved and moved. And then when he came to me, said, Gogo, am I still going to move again? I said, no, my darling, you won't move. Here you are permanent. So he knows as he saw me. Yeah, and then we started fighting one day because he's very artistic. He can look at you and draw you. He drew me sitting on an armchair. I said, Nganye so? Throw away that. People are going to think that I've got a stroke.
So a question for you, Meg. Obviously, we've heard a lot about kind of the challenges that faced with so many patients. I'm just kind of wondering, when you are selecting Greta Scholars, what are you looking for? What are the qualities of nurse that you're kind of hoping to find?
Well, like Sister, what are some of the qualities that we look for in our Greta Scholar candidates? Because as Sister Abby has very poignantly demonstrated, it's a tough job, and it takes quite an extraordinary person in the best of circumstances. But our scholars are very committed to working in their communities. They're passionate about nursing, and that is something that we strive very hard. Many of them have had also a very rough upbringing. They're AIDS orphans, they're conflict survivors, and it's not a free ride. They work very hard to get to that point of nursing school, and then they work very hard in nursing school, and then of course they work very hard after nursing school. So it takes someone very committed and very passionate about nursing and about helping others and going back to their communities, because that's where they're needed. Thank you. Yes?
Has the AIDS epidemic subsided as much over there as here?
Has the AIDS epidemic subsided as much there as here?
It has. But there's still a lot of education needed. The people are getting ARVs, and they get so well that, especially the females, boys are sub-7. If the man says jump, you ask one question, how high? And when you tell them you have to contracept because you're on ARVs, even if your child will be negative, but your immune system goes down, and the schedule that you are on won't help you. You'll have opportunistic diseases. They don't believe that if they now nice and round, they've been skin and bone, now they're nice and round, they've got calves, then they say, let me get another child. And then that's where things don't go well, and then after delivery, she just dies. They're still dying, but not as bad as before. There are some who listen, there's some who don't listen. What I've done, I've put in condoms all over. When I was doing community nursing science, I designed a taxi rank where I've got containers of condoms being labeled in the whole of that taxi rank. It's not that I'm a mayor, but when I finished my project, my lecturer said, please present this to the municipality, and they used that. And I said to them, when it's built, I want to put condoms there so that people can condomize. Some do, some don't. Yeah.
Yes.
During the height of the AIDS epidemic, when you were burying people day in and day out, did your faith ever waver?
Not at all. My faith made me strong, because there were times where I sat with these children when their parent died, waiting for the last breath. If she was still able to hear me, these are the questions that I used to ask from her or him. Say, would you like us to sing for you? If she says or he says no. Would you like me to pray for you? If he still says no, what do you want us to do? Can we hold you, or you want to die in my hands? Usually they like to die in somebody's hands. I don't know why. So there were times that day in, day out, I had to help them and hold them and until they stop breathing. And then I prepare the body. Sometimes they ask their own children. One of my orphans came to me before he was an orphan, and the mother was very sick. He said, I don't want my child to stay with my father because I know you won't be educated. So I took him at the age of 2 years, and then at the age of 9, the mother was critically ill. So when I did exactly ask those questions, he said no, he wants his son to hold both hands. And he did that until she passed out, and I prepared the body, called the heirs to come and pick up the body. The child didn't cry, and I said, good boy, you are so strong, my son. Went back home, we prepared for the funeral. On the day of the funeral, he didn't cry. But after 2 weeks, he had panic syndrome. He would scream badly, and look at and then I say, what's wrong, Stem? What are you doing? Go hold me. And I was to hold him, pull him down onto my bed, and say, I said, what's happening? Well, anything happening on her chest? No, Gogo. What are you seeing? He didn't want to. It was then that he was starting to, should have cried, but being a man, didn't want to cry, and he had a panic syndrome. Eventually, I had to put him on sedation for a few weeks, and he was fine.
Can I, we only have a few minutes, if I can end on an inspiring note. Of course, that was very powerful, unimaginable, really. In 2008, you won the Unsung Heroes of Compassion Award, given by His Holiness the Dalai Lama. Can you tell us briefly what that must feel like?
It was wonderful. It was the first experience of being in another country, it's number one. 2, meeting him. I had never seen him, but it was such an excitement that I had. Especially when he read my citation, and then he gave me a kata and said life is not complete because the edges of a kata is not sewn. And he said to us as honorees, please do help other people. But if you can't help them, don't hurt them. You always have very short, powerful words. And he even said, there was a time when they asked him, what is the name of your church? He said, kindness. So it was really, and also being at Ritz-Carlton Hotel, I've never been to a hotel.
And on that note, you are so extraordinary, and it's really been an honor. And I know you've touched all of us here, and I'm so grateful. I hope one day to go to your part of South Africa and get to see the work you're doing firsthand as well.
Wonderful.
Maybe we can get some Greta scholars over there.
I invite you, if you come to South Africa, don't forget to go to Underberg. You'll be so thrilled. At the moment, I've got an Australian volunteer that came to me on the 1st of February, and I was going to be flying out of the country on the 17th. And the first thing I said to my friends, the farmers' wives, I said, please take her up the Sunny Pass. When she came back, I said, Gogo is the best present that you gave me for being here. She loved it. The scenery there is fantastic. And you must know that you're going to a place which has got fresh air, fresh water. Get the water that comes from the spring on the mountain. No factories. We don't have factories, so no pollution. pure, 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 pure water.
So now we get a chance to meet her. I really highly recommend this book. It's very powerful, and she'll sign it for you. I'm very lucky. Do I get a hug, though?
Yes, oh,
Okay,
please.
good.
Those people can hug me. So,
Yeah, see, now we can hug.
I wish you the best for life and for all the work that you. I think Greta up there is looking at you and saying, "Oh my baby."
No, thank you, thank you. Okay, let's make sure we don't slip here. And you have to make sure you're okay with these stairs.
Okay.
We'll get you some water. Hi, John. This is my good friend, John. He's family.
felt really bad for your sake. It's just, yeah, another thing. We just have